Hey, welcome back everyone. If you're new here, my name is Justin Lee, fitness coach and third year physical therapy student at Azusa Pacific University. Here you'll find videos on fitness, physical therapy, and lifestyle that helps inspire self-change. This channel is all about lifting others and lifting weights. So let's lift for change, people. Alright, this episode is an interview with the one and only Clara Atkins. These pre-PT videos on this pre-PT playlist gives classroom and clinical experiences, along with giving you the inside scoop on how to get into and thrive in DPT school and how to set yourself up for success after school is done. So this is about setting yourself up for success after school is done, because in this interview we talk about residency and fellowship from somebody who's already gone through the residency program and now is already enrolled in fellowship right now. Guys, the person that I interviewed here is just amazing. Now, when I was a first year DPT student, she was a third year DPT student, and she actually TA'd me for like pretty much most of my classes in physical therapy school. After this interview with Clara, oh my goodness, like if you're trying to get motivated right now, and if you're a DPT student and you're on the fence of residency or work in the real place, you have to listen to this. If at any point in this video you feel moved or a sense of like urgency to want to do something to change, give this video a thumbs up. Please feel free to comment on things that you really liked, things that you maybe, if you already went through residency, you can talk about some things you learned, or if you're even thinking about doing residency. Let me know. I want to hear your feedback. But guys, here's the interview. Let go.
What?
All right. Hello, everyone. Welcome. We are at an interview with the lovely Clara Atkins. And if you do not know, Clara has been my TA when I was a first year in DPT school and my second year as well. And honestly, great things, I'm going to compliment you right here.
You're too kind.
Is that without her guidance, I really think that I wouldn't be where I am today. And I feel like she really has pushed me and guided me so much, where I felt like I was really ready and prepared when I went into all my classes and when I went into rotations as well. So that's Clara. She's amazing. She'll talk more about herself, but basically she's resident trained. She's currently in a fellowship, sports fellowship right now through Kaiser, and I'll let her take away and talk about her background and stuff. So couple questions for you.
Mm-hmm.
Could you just give a little bit about your background, where you graduated from, and your journey and where you're at right now?
Sure. Hi, everybody. So I went to Azusa Pacific University, 3-year program, graduated in 2017. I did my orthopedic residency through Kaiser right after, and then went straight into sports fellowship the Monday after I graduated residency. So it's been a long journey for me.
Damn, 5 years.
Yes. It's been worth every single minute. I'll find out this month if I passed OCS, crossing my fingers.
Oh, shoot.
But yeah, it's been a good learning experience. It's been a good opportunity. I've been really blessed to have been a resident at Orange County, and then now a sports fellow at Orange County as well. So I've learned a lot. I've learned a lot more than I even dreamed about learning. But yeah.
Okay.
Anything else?
No, that's good. Thank you. Well, thank you for that background information. So I was wondering why you chose residency and fellowship in the first place, because those of you who don't know, right after DPT school, you can just go straight into work and work with the full-time salary and all that stuff. So why the additional schooling, and why another year for a fellowship?
Well, I think when you do your rotations and then you finish school, you still don't feel quite ready to treat everybody. Your success rate as a student might have not been so high, and then you have somebody there with you kind of guiding you. So then you kind of going off on your first day alone is a little intimidating, and I seem to be the type that's never, what's the word? It's never good enough, where I want to make sure I give the most out of my treatment. I give the most out of my communication. I give the most to every single person. Yeah. And everybody's so different. And you end up getting out of it. And even, I mean, I went straight into residency, and I was blessed through APU to have that understanding of why residency, and it's going to put you 5 years into the profession, and it's going to just make you grow a lot quicker, and more efficient, which intrigued me initially. But I think being done and looking back, you still go into your first day of residency without even having a mentor, and just still kind of being like, what am I doing? I have a full load. What am I going to do? So having that guidance for a year, even if it's once a week, and then having the additional education, the additional mentorship on the weekend, really does put you 5 years into the profession. You almost still feel like a student as a resident, and you're still learning a ton, and you're still growing, and you finally have this idea of what a persistent pain patient represents, and you still have this idea of how this pattern's going to look. And it has allowed me to just, the whole purpose and why I think I did it was just, it has allowed me to be more efficient. It has allowed me to give better care. It has allowed me to give better care quicker, rather than learn from my mistakes 5-10 years down the road and then trying to figure it out. I'm not sitting here saying I'm perfect and I get it right every single time, but I have been able to grow and learn and give back to my patients better, and just give them a better plan, give them a better treatment, give them a better clinician. So I think just, I didn't want to end school and then learn all these habits and all these poor habits and make all these mistakes for years down the line and then finally learn from them. I wanted to continue growing from the best of the very best. And then after that, if I make mistakes, then I know there's truly a reason why I made the mistake, and I'm going to learn from it a lot quicker than I would have 5 to 10 years down the road.
Wow, that's I mean,
long.
No, that I mean, even just talking to you here, I mean, I'm just so inspired by what your mindset is throughout all of this, and the fact that you're investing in yourself for the betterment of the patient, and like doing everything you can. So the goal is, all right, the patient gets the best care, and the fact that you're continuously saying, well, I'm still learning and I'm still growing, and if I make mistakes there, then I'm going to learn from that. And I really hope that many of you viewers and many other clinicians today can be more like you, because we need more clinicians like you who have just a heart to serve the population with like the biggest heart that there is. So thank you for that. So I know that you are doing a Kaiser residency, and I know there are many residencies out there in the world. Can you talk a little bit about Kaiser, what makes it unique, and why you chose that versus something else?
Yeah. So, I mean, for those of you who are listening who are from APU, you kind of have an idea of the whole Kaiser system. However, I mean, I can't sit here and say much about the other residencies as I wish I could, but for the residency and fellowship through Kaiser, I think my whole purpose of doing it is I was blessed to have been taught by a lot of the Kaiser clinicians through here, and seeing how they look and how they treat and how passionate they are. And it inspired me to want to be like them and to learn from them. And I mean, looking back, I just, no doubt it's like the best of the very best. So I'm just, that was my whole thing, was residency is about making a better clinician. It makes your skill sets better. It makes you communicate better. It allows you to see your faults. And each mentor at each different location has a different way of doing it, but a beneficial and efficient way of doing it. and you have the ability to learn from different ones. I was able to have, at Orange County, I was able to have two very different clinicians that have shaped me into the person and clinician I am today.
Right.
And I was able to take different pieces of them and apply it to how I treat. And they definitely allowed me to see my faults quicker and learn from them, and essentially make me a better clinician, which is what I wanted to do. I wanted to make less mistakes. I wanted to be more efficient. I wanted to give back better. So that goal was, and even far beyond it, was achieved. The reason I did sports fellowship, and the uniqueness for that,
Crazy.
They say, or at least the individuals that run the residency and fellowship say that with fellowship they're teaching you to be a leader. And I truly believe that. And fellowship, yes, goes in depth and fine tunes your sports ability to see the movement, your ability to treat the sports. The plan of care is going to be way different for an athlete. So being able to manage and adjust that, I'm still making myself a better clinician in order to treat sports. So that was a small but a good part of why I wanted to do it, and what Kaiser offers from it. Right. I know we're able to have a class with Drew Marcos out of USC over at Modus. Right. We have some people coming in, clinicians that are going to talk about each different sport and kind of look at the different movement, which definitely intrigued me. We have Chris Powers multiple times. It's a lot. It's heavy. Yeah. I know all of you guys who are applying to residency and fellowship, you look at the schedule and you're like, I don't want to do it. I'm supposed to have my weekends. I'm not supposed to study anymore. Yeah. And totally, I get it. I was there. I almost didn't do sports fellowship for that same reason. However, it's 1 year, guys. It's 1 year. It's 1 year of giving it your all. It's 1 year of learning from some of the best clinicians out there. And it's 1 year of you realizing your faults before they even need to tell you. And Kaiser does a very good job from it. On top of that, connections are really great. Obviously, the finances, that ends up being really good. The benefits end up really good. And that's all a great part of it and a good addition. But you end up truly becoming a part of the Kaiser family. And in the end, the fellowship is going to be able to teach me how to be a leader and how to be able to mentor students and how to mentor residents and hopefully to mentor fellows. And that's ultimately what I want to do, and that's one small piece that you're able to get out of the fellowship and the residency.
Wow. Well, I mean, when I was a student, you mentored me like phenomenally. So, I mean, by going through this residency and fellowship and seeing or imagining you mentor residents and fellows, I already know you're going to do a fantastic job.
Thank you.
I mean, it's your calling. And really quick, she was a GSA here at APU, so that's like a grad student assistant. Basically a really hard position to get, and only like a few of the selected students get it, and she was selected as one of them. So Clara is amazing, and I'm just blown away with everything that you have to say so far. Could you talk about mentoring and talk about how that was structured? You talk about how mentoring is so important in residency and Kaiser. So can you tell me about how that was, how many hours you got, and things like that?
Yeah. I think at the end of the day, it ends up accounting for over 200 hours total with a year of just mentorship. So once a week you get mentored for 3.5 to 4 hours as a resident. I believe it's 3.5 hours as a fellow currently. It's once a week. You have prep forms that you're prepping for those patients up until then.
Heard about that.
Yeah, so it's a lot, and then it becomes secondhand, so you'll get it done quick. So starting off as for those of you that are applying as a resident, it'll be 2 evals and a return prep form. So a return patient that you'll end up seeing. So 3 people you get mentored by. Once you get to a point where you kind of nail your subjective, you got your objective down, there's not really a concern or a problem or things that you need to work on there. It transitions normally middle of the year to 3 return patients and then 1 eval. Oh. The purpose of that is you've kind of nailed the initial visit. Now you need to work on the follow-through and the plan of care and how to progress your patient or how to regress your patient. So then it ends up switching gears a little bit. It's different for every facility, at least through Kaiser. As our resident, there's some facilities that only have 1 mentor. Most of them have 2 to 4 mentors. Wow. So at least you kind of get an idea of different clinicians' perspective, their teaching style. So you end up learning a lot. So I had 1 for 6 months, and then at the 6-month mark, I switched to the other one. Gotcha. Through Kaiser, regardless, if you're full-time, you're going to work 4 10-hour shifts. Oh. So your mentoring is like 3.5 to 4 hours of that time. And then some of them are part-time, so then it's 2 10-hour shifts, I believe.
Gotcha. Mm-hmm. I think they just upped it to about, so part-time you have to have a minimum of like 25 to 30 hours now or something. Okay, nice. Yeah.
So it ends up being a big part of it. It's the biggest thing that I think I got out of residency and that I'm currently getting out of fellowship. But yeah, with residency it's a little different, but with fellowship you end up getting like 6 to 7 different mentors. It switches every 6 to 8 weeks. But yeah, you're technically as a fellow getting tested every week that you get mentored, so it's a little bit higher stress, but it ends up being worth it, and you kind of don't even realize you're getting tested, mostly because you're just trying to get better. As a resident, you'll have at least through Kaiser, you'll have 3 different testing opportunities. So then you'll have a clinician somewhere else that comes in and then will test you on those either 2 evals, 1 return, or 3 returns, 1 eval.
Can you talk about what the testing procedure is like? And like what do you mean testing? Like, do you have a written test or someone's watching you, or what's that look like?
So there is a written and there is a practical through Kaiser. There's a midterm one and then there's a final one. The purpose of the written is to get you ready for OCS. So it's a nice way of refreshing it, especially if you're not right out of taking boards or it's been a couple years, or even if you are, those tests are hard. So trying to study for those questions, it was nice at least getting an opportunity. And I know the residents at Panorama City last year did a study where it looked like the pass rate of the Kaiser testing in comparison to those that passed the OCS, and I think it was either 100% or 95% of them. Wow. It was a high number. Wow. It was good. Don't quote me on that. I'm not quite sure, but it was high. Yeah. So that's another plus, right? Yeah. Then for the clinical testing, you'll have somebody from another facility come in, and they'll it's almost like mentoring, but a little different. It's sectioned off to two of the weeks, in the middle, in the first third of the time, the second third, and then at the end. And it's 2 days of testing, so it can either be 2 the first week, 2 the second week, or 1 week, 1 and 1. Wow. It ends up being similar. The reason why I said it ends up being similar to mentoring is you're still doing your prep forms the same. You're still doing all of that stuff, but you just have to be a little more on it in your clean cut and reassessment and all those little things just to nail the boxes, but you still want to get the most out of it. So you still want to give the more difficult patients or the ones that you want to learn from. But yeah, it's looking back, it was very, very stressful. Like, I know the residents currently are going through their testing right now, and it's stressful. But you get done, and you end up learning a lot because you get a quick perspective of somebody else, and they see things that sometimes your current mentors don't see. So So even though it's mainly that insecurity and that nervousness of being tested.
Right.
So like the first day, normally they won't say much. So it's kind of awkward because it's like a fly on the wall and somebody just sitting there just staring at you, right?
Just doing your stuff.
Yeah. And then the second day is a little more like easy. They kind of know how you treat, they kind of know what you need out of it. The first day they're almost learning from you too and seeing what will make the most out of this testing.
Wow.
It's stressful. You get through it. It's only 2 days. The first one, I will admit, is probably the most stressful because you're uneasy with it. By the end of it, you kind of know what you know you have to do. You know what they're looking for and essentially what you can give, so it's a little easier.
Do they have like a check mark kind of thing, like a checkbox, and do you get that ahead of time so you are aware of what to prepare for kind of thing?
Yeah, so you'll get a residency handbook at orientation, and it'll show the exact form that they use for testing. So it's not out of the blue. You have no idea what you're being tested on. And it's similar things like, did you look at red flags? Did you rule out this? Did you rule in this? Was your clinical reasoning appropriate? Did you reassess? So it's probably similar to most of your guys' practicals and exams, essentially, that you did within school. And that's what I mean by checking the boxes. But you still want to get the most out of it. So you end up wanting to put, like I've given advice to current residents right now, you don't want to put the easiest people in there that like a total knee or not easy, but things that are very straightforward. You want it to be a little where you have to work for it. You end up learning the most from those anyway.
Wow. Well, that sounds very stressful for all those testing situations, but I'm sure you benefit so much from it. And through every test, I mean, even here through APU, I grow through every single test just because, you're thrown into the water and it's like, all right, well, you better swim. And I think it's one of those same situations.
Yeah, for sure.
You talked about working. You said like some are 40 hours for full-time and part-time. Do you get paid while doing that? Do you like what's like some benefits for like residency? Because I know it's not just the mentoring, but you also get paid while working and maybe some benefits and things like that. Oh,
Sorry.
It's okay. And could you just talk about that a little bit?
Yeah. So you're still considered a full-time employee or even a part-time employee. So just because you're a resident, it's almost like just an additional job title. So your benefits through Kaiser end up being the same as, like, say I was the resident and you were just the clinician. Like, my benefits are still essentially going to be the same as yours.
Wow.
My pay might not be.
Okay.
But the benefits-wise, your 401k, your PTO, all of that stuff, it's still essentially the same.
Wow.
The only difference is if you're part-time or full-time. How much of that you get is different.
Gotcha. So it's like an hourly pay pretty much.
Yes.
Yes. Gotcha. Cool. I know you talked about the pass rates for residents and Kaiser has like a pretty high pass rate, as you said. Those of you who are looking into residency, that's something that you should look out for as well, because if the place that you're going for has a high pass rate, then that's really important to also realize, because if it's low, then you're likely like not gonna pass the exam, which is also a big reason why you want to do residency as well, to get that specialty or specialization like the OCS, NCS, and things like that.
Yeah, and I think we kind of had a discussion of this at our last residency class together when we were presenting our research after they actually said the numbers of our pass rate through Kaiser. However, during that time, people were applying for jobs after. The ones who weren't planning on doing a fellowship or anything like that. And that's when we hadn't even taken the OCS yet. And it was nice to hear that even though they didn't get those letters and those titles in OCS, the fact that you have Kaiser's residency on your what's it called, resume,
Right.
is a lot. It's almost rated, if not equal, above an OCS title.
Wow.
At least for what I heard. I didn't go through it, so I'm not quite sure.
Right.
But at least what some of them were saying was they would go to the interview and they would ask them, so you did a Kaiser residency? And they said, yeah. And they were like, great, you're hired. So it has a really good reputation. The clinicians have a good reputation. The system has a really good reputation. The whole thing does. So OCS does become a big part of it because you are investing all these hours. However, to put yourselves at ease of mind for taking the test at the end, it's not what's going to end up getting you that dream job or that job that you're looking for.
Right. Wow. So, I mean, yeah, it's a lot of benefits for being Kaiser. I mean, of course, the rigor of the program, but the fact that it's on your resume already is like, well, like you did that. Mm-hmm. Okay, let's move you on to the next application process.
Yeah. I
had no idea that Kaiser was actually that highly recognized and reputable and respected like that. So.
Yeah.
Might change some perspectives in mine too, because we all want a job at the end, and it is great. Obviously, all the perks for the mentorship, but you know, having such a reputable thing on your resume is a perk as well.
Definitely.
Okay, a couple more questions. Could you talk about, like, in your opinion, because obviously you did residency and you got into fellowship, which is obviously very hard in itself. What characteristics do you think you possess, or what characteristics do you think a resident or a fellowship should have to be successful, to be admitted into their program? Like, what are some things that, like, you have or you're working for? And could you talk about that?
Yeah. I think the biggest thing is, of course, you need to have compassion for others, but you need to have compassion and the ability to work outside your scope. So to volunteer, to do things outside, and to give back to the community is a big thing that they're looking for, because essentially Kaiser does a really good job of reaching out to those communities. So during the residency and fellowship, you'll end up going to a clinic and giving back to those that don't have the ability to have insurance, or so you end up giving back in those ways. But they like to see that you're doing other things within the community, whether it's just through physical therapy or through a sport or through athletic training or something. Mm-hmm. They like that a lot. So having that compassion and that work ethic to be able to do that is definitely a plus. The second thing, at least in my perspective, for the ones that did well in residency and got through it, is you need to be able to have the ability to take feedback.
Oh, yeah.
It's not always going to be the best feedback.
Yeah.
You're not always going to be the best clinician out there and have done the best job. And that's the reason you have to be humble in a sense that you need to look back and understand that's why you're doing it. And having that ability to take that advice and apply it quickly or learn from it and understand what they're saying is a big part of it. You can be the best clinician out there and you can be the happiest go lucky person, but if you don't take feedback well and you don't take critique well, or that mentorship or that precepting is what they call it now, you're not going to necessarily do as best as you can within a program or even within your job. So I think, at least from my perspective and what I saw at least helped me through it, you don't leave every mentorship feeling like the worst thing in the world if you end up having that outlook.
Yeah.
Right? Because you have somebody sitting there telling you everything you need to do better, right? Things you did well, of course, but a big part of it is what you need to do better and what you need to work on. So taking a step back and not leaving it so angry with yourself and so defeated and feeling so dumb at times is a big part of just getting through it and just being successful in anything you guys end up deciding to do.
Wow. Yeah, well, I mean, you know, as a resident and fellow, you're a student. You're like an apprentice. So it's like having that mindset of the ability to learn, the willingness to understand and grow, I think will take you so far. And the fact that you are talking about that is, I think that's really important as well. Even as students, if you're in undergrad or in DPT school now, like you have your professors who are telling you, and if you're gonna be just stubborn and hard-hearted, then like
you're gonna have a difficult time.
You're gonna have a difficult time. And so if that's you right now, it's time to change. Switch your outlook. Okay, last question, Clara. What are your future plans? Like, what are you doing? You're finishing up your residency and your fellowship. Some people do double fellowships. Some people move on to going into professional sports. You're doing a sports fellow. So, if you can have a ideal profession or goal or wherever, what would that look like for you?
Yeah. I will not do another fellowship. For those individuals, I have a ton of friends who do. More power to them. Awesome. You learn a ton. You invest a lot of your time. You get a lot out of it. So more kudos to them. I'm not going to do another year. My biggest thing is I want to be able to be a mentor. Or a preceptor is what they're switching the word now. So I'm getting used to it. I want to be able to precept either a student, a resident, a fellow, starting off with student, but then hopefully progressing to a resident fellow. That's definitely, I know it doesn't sound like the most hype thing after a sports fellowship where you're not doing like this big thing or you're not working with this team and all that, but like Justin was saying, when I was a GSA, I didn't realize how much I loved to teach until I was in that position. Yeah. And then I realized how much I got out of it. And how much and how important and how helpful it was to you guys that I've done so far. It was really rewarding in a sense, and it meant a lot. So I think being able to push someone who's not necessarily in a student setting, but in a clinical setting, I really want to be able to have the opportunity to do that. So hopefully, crossing my fingers, I'll be able to do that.
Will you still be working at a clinic or anything like that, or you just want to be like full-time, like mentoring people or stuff like that?
No, I still want to work in a clinic. I still want to work with patients. I'm hoping when it ends up working out that I end up getting a position, hopefully through Kaiser when I'm done, because essentially that mentor program would be amazing to be a part of.
Right.
I've gotten a lot out of my mentors, so being able to hopefully give somebody that opportunity as well would mean a lot. So crossing my fingers. I still have a while to go. I have like a half a year, so it'll be good.
You're a year and a half ahead of me, so I mean, keep going, girl.
You're good.
Lastly, I have something for you.
No, you don't.
I do.
Why do you have anything for me?
So this is for you.
Is this a live for change
This
shirt?
is a live for change shirt. It is. Clara was my TA, and then I, was putting out live for change apparel, and she really wanted this gray live for change racerback, and I said it was limited edition, and she couldn't get it, and
I got it
now she's got it years later.
These are the best. They're so soft.
She said they're the best, and they're so soft. So thank you again for. Thanks, Clara. Thank you again for joining us here today. I'm sure all the viewers and listeners who have been a part of this have been really phenomenally inspired. I mean, just having this conversation with you, I've been phenomenally and exponentially inspired. And if I were on the fence for residency or fellowship, after this conversation, I already know what I'm going to do. So
you'll do great. I have no doubt with you at all.
Thank you. Thank you so much. Well, that's it, you guys. So thank you again for joining in. I hope this inspired some self-change within you, because change people. And that's why we live for change people. Have a great one, you guys. Wow. Down. Whew. Don't you feel like you're motivated to do something right now? Oh my goodness. Like, after listening to that again, game over. Definitely doing residency. If you're on track with my vlogs, I did start my third rotation, finally, my last one, and at this time I'm thinking about doing residency. So after having this interview with Clara, it definitely solidified that yes, I'm taking the leap and I'm taking the steps to go to residency, baby. So I hope you took something from this video and it stirred some kind of self-change. Change people, change people. That's why we live for change, people. Have a great one, you guys.